If you're over 70 and you've been dismissing those bulging veins on your legs as just a cosmetic problem, something that comes with age, I need you to stop everything you're doing right now and pay very close attention to what I'm about to share with you. Because what I witnessed last month in my clinic changed the way I approach every single patient who walks through my door with varicose veins. A 74-year-old woman came in thinking she just had tired legs. She almost lost her ability to walk. And the worst part? Every warning sign was there for years. She just didn't know what to look for. I'm Dr. Emily Hartwell, and I've spent over 2 decades specializing in vascular medicine. In that time, I've examined more than 15,000 patients with venous conditions, and I've performed thousands of diagnostic ultrasounds on legs just like yours. If there's one thing that keeps me up at night, it's knowing how many people are walking around right now with varicose veins that are silently progressing toward something far more serious. These aren't just cosmetic issues. These are windows into your circulatory health, and they're trying to tell you something important. Today, I'm going to walk you through 5 symptoms that most people completely ignore, symptoms that your body is using to scream for help. I'm going to explain why each symptom matters, what's happening inside your body when you experience it, and I'll share real stories from my practice that illustrate exactly why this information could change your life. And I promise you, by the end of this video, you'll never look at your legs the same way again. Before we dive in, if you haven't subscribed to this channel yet, I highly recommend hitting that subscribe button and turning on notifications so you never miss another health tip made especially for you. And if you find this video helpful, please leave your suggestions and questions in the comments. I read every single one, and it helps me create more content to help people just like you. Now, let me tell you about Margaret. Margaret Thompson, 76 years old, a retired school teacher from Portland, Oregon. She spent 35 years on her feet, educating generations of children, and she was proud of it. Margaret was the kind of teacher who stayed after class to help struggling students, who organized field trips on weekends, who was still receiving thank you letters from former students well into her retirement. When she first noticed those purple, twisted veins appearing on her calves in her early 60s, she did what most people do. She bought longer skirts and moved on with her life. Her doctor at the time told her it was cosmetic, nothing to worry about unless it bothered her appearance. So Margaret pushed through the occasional aching, blamed it on age, and continued living her life. She gardened in her beautiful backyard, growing roses and tomatoes. She babysat her 3 grandchildren twice a week. She volunteered at her local library, helping children with reading programs. Margaret believed she was doing everything right. She was active, engaged, and living life to its fullest. But here's what Margaret didn't know, and what I desperately wish someone had told her. Those veins were the visible tip of a much larger iceberg. Beneath the surface of her skin, a progressive condition was silently advancing, and the first symptom she ignored was the one that could have changed everything. The first symptom I need you to understand is persistent heaviness in your legs that gets worse as the day goes on. Now, I know what you're thinking. Everyone's legs feel heavy sometimes, especially as we get older, and you're right. But there's a specific pattern to varicose vein heaviness that's different from normal fatigue. This heaviness starts in the morning feeling manageable, maybe even unnoticeable. But by afternoon or evening, it feels like someone has strapped weights to your calves. It's not just tiredness. It's a deep, pulling sensation that makes you want to elevate your legs immediately. Let me explain what's happening inside your body. Your veins have tiny one-way valves that help push blood back up to your heart against gravity. When these valves weaken or fail, blood starts pooling in your lower legs instead of flowing upward efficiently. This pooling creates pressure, and that pressure is what you feel as heaviness. After 70, these valves have been working for 7 decades. They've endured millions of cycles of opening and closing. Some of them are worn out, and they're not doing their job anymore. I remember Thomas Richardson, 72, a former long-haul truck driver from Memphis, Tennessee. Thomas was a man of simple pleasures. He loved country music, fishing on Sunday mornings, and playing fetch with his golden retriever, Duke. He had driven over 2 million miles during his career, crossing every state in the continental United States. Thomas sat for hours every day for over 40 years, his legs bent at the same angle, his circulation fighting against both gravity and immobility. When he retired, he thought his leg problems would get better since he wasn't sitting behind a wheel anymore. He had dreams of being more active, of finally having time to do all the things he had postponed. But his legs got worse, not better. He described the heaviness as feeling like his legs were filled with wet sand by dinner time. It was a sensation he couldn't shake, no matter how much he rested. His wife, Dorothy, noticed changes that Thomas tried to hide. He stopped wanting to go for their evening walks around the neighborhood, something they had done together for their entire 48-year marriage. He stopped playing with Duke in the backyard because standing for too long made his legs throb. He started making excuses to stay seated at family gatherings, missing out on moments with his grandchildren. When Thomas finally came to see me, the ultrasound revealed significant valve failure in both legs. The blood that should have been flowing back to his heart was instead sitting in his lower legs, stretching his veins further, damaging more valves, creating a cycle that was getting worse every single day. Thomas told me something that broke my heart. He said he thought he was just getting old, that this was just what life after 70 felt like. He had accepted it as inevitable. But it doesn't have to be. Thomas deserved better, and so do you. If you're feeling that persistent heaviness, especially if it follows this pattern of worsening throughout the day and improving when you elevate your legs, this is your body's first warning signal. Don't ignore it like Thomas did for 3 years. But if that surprised you, wait until you hear about the second symptom, because this one fools almost everyone. The second symptom is nighttime leg cramps and restlessness that disrupts your sleep. I cannot tell you how many patients have come to me after years of terrible sleep, years of waking up at 2 in the morning with their calf muscles seized in painful cramps, only to discover that their varicose veins were the culprit all along. Most people blame these cramps on dehydration, or potassium deficiency, or just age. They drink more water, eat more bananas, and hope for the best. But when varicose veins are involved, those cramps have a very specific cause. When blood pools in your legs during the day, it creates a buildup of waste products that would normally be carried away by healthy circulation. These metabolic byproducts irritate the muscle tissue. Then, when you lie down at night and the pressure dynamics change, your muscles react, they cramp, they twitch. They make it impossible for you to get the restorative sleep your body desperately needs. Patricia Gonzalez, 78, a retired nurse from San Antonio, Texas, knew more about medicine than most of my patients. She had spent 40 years working night shifts in the emergency room, caring for thousands of patients during some of the most frightening moments of their lives. Patricia understood the human body. She could read vital signs instinctively. She knew when something was wrong. But even she missed this connection in her own health. Patricia had been having leg cramps for 5 years. They would strike without warning, usually between 2 and 4 in the morning, pulling her from deep sleep with searing pain that made her cry out. Her husband, Miguel, learned to help her through these episodes, massaging her calves until the muscles finally released. Patricia tried everything her medical knowledge could suggest: magnesium supplements, potassium-rich foods, stretching routines before bed, compression socks she bought at the pharmacy, even prescription muscle relaxants that left her groggy and confused the next day. Nothing worked consistently. The cramps kept coming night after night, week after week. When her daughter, a physician herself, finally convinced Patricia to see a vascular specialist, that's when she ended up in my office. The irony wasn't lost on either of us. Here was a woman who had spent her career helping others recognize warning signs, and she had missed her own for half a decade. Patricia's ultrasound showed moderate to severe venous insufficiency in her left leg and mild insufficiency in her right. The valves that should have been keeping her blood moving were allowing it to flow backward, a condition we call reflux. Once we addressed the underlying vein problem, her cramps reduced by over 80% within 3 months. She told me it was the first time in years she had slept through the night consistently. She cried in my office, not from sadness, but from relief and frustration that she had suffered unnecessarily for so long. If you're still watching and finding this information valuable, drop a comment below just to let me know you're with me. It helps more than you know, and it tells me that this content is reaching the people who need it. Now, the third symptom is one that I find particularly concerning because it's so easy to misinterpret. I'm talking about skin changes around your ankles and lower calves. This includes discoloration, itching, dryness, or a texture that feels different from the rest of your skin. Here's what most people do when they notice these changes. They assume it's dry skin from aging and apply more lotion. They think it's eczema and try over-the-counter creams. They blame it on a reaction to their laundry detergent. What they don't realize is that these skin changes can be early signs of chronic venous insufficiency, progressing towards something much more serious. When blood pools in your lower legs over months and years, it creates sustained pressure against the walls of your veins. This pressure eventually affects the tiny capillaries in your skin. Fluid and proteins leak out into the surrounding tissue. This leakage triggers inflammation, and inflammation changes your skin. You might notice a brownish discoloration, especially around your ankles. This is caused by iron deposits from red blood cells that have escaped from those damaged capillaries. You might experience itching that no cream seems to fully relieve. The skin might become thickened, hardened, or develop a leathery texture. These changes have a medical name. We call it stasis dermatitis or venous eczema. And it's a warning sign that should never be ignored. Let me tell you about Robert Chen, 81 years old, a retired aerospace engineer from Seattle, Washington. Robert had spent his career at Boeing, designing components for commercial aircraft that carried millions of passengers safely around the world. He was a problem solver by nature, methodical and precise in everything he did. His garage workshop was organized with the same attention to detail he had applied to his engineering work. When Robert noticed his ankles turning a brownish color and his skin becoming itchy, he approached it like an engineering problem. He researched online, reading medical journals and health websites. He tried different moisturizers, carefully noting which ingredients they contained. He kept detailed spreadsheets about what seemed to help and what didn't, tracking the progression week by week. His wife, Linda, watched him approach this problem the same way he had approached every challenge in their 56 years of marriage. She trusted that Robert would figure it out, but he never once considered that his varicose veins might be connected to these skin changes. To Robert, the veins were one problem, completely separate, and the skin was an unrelated problem. He had no idea they were part of the same underlying condition, two manifestations of the same circulatory failure. By the time Robert came to see me, the skin on his left ankle had progressed to a stage where we were genuinely concerned about ulcer formation. The tissue was fragile, discolored, and showing early signs of breakdown. Robert was shocked. He kept saying that he wished someone had told him earlier. He had looked at those varicose veins every day for over a decade and never understood what they were doing beneath the surface. This is why I make these videos. Because the connection between what you see on the outside and what's happening inside isn't always obvious. And sometimes, by the time it becomes obvious, you've lost precious time. The fourth symptom might be the most alarming when you understand what it really means. I'm talking about swelling in your lower legs and ankles that wasn't there before, or swelling that's gradually gotten worse over time. Now, swelling can have many causes: heart problems, kidney issues, certain medications, even just sitting too long on an airplane. But when swelling is connected to varicose veins and venous insufficiency, it has certain characteristics that set it apart. This type of swelling, called dependent edema, typically affects both legs, though it might be worse in one than the other. It gets worse as the day goes on and improves overnight when you're lying down. If you press your finger into the swollen area, it leaves an indentation that slowly fills back in. We call this pitting edema, and it's a sign that fluid is accumulating in your tissues. Here's what's happening physiologically. When your venous valves aren't working properly, pressure builds up in your leg veins. This pressure forces fluid out of the bloodstream and into the surrounding tissues. Your lymphatic system tries to compensate by draining this excess fluid, but over time, it can become overwhelmed. The swelling you see is the visible result of this fluid imbalance. Eleanor Williams, 73, a former real estate agent from Phoenix, Arizona, first noticed her ankles swelling about 4 years before she came to see me. Eleanor had been one of the top agents in her region for over 2 decades. She was known for her energy, her willingness to go the extra mile for clients, and her ability to walk through dozens of homes in a single day without breaking a sweat. She had always been active, showing houses from early morning until late evening, walking neighborhoods to scout new listings, climbing stairs in multi-story homes. Her legs had carried her through thousands of property showings. But gradually, she started noticing changes. Her shoes felt tight by the end of the day, something that had never happened before. Then her socks started leaving deep red marks around her ankles that took hours to fade. Then she could barely fit into her favorite pair of Italian leather loafers, the ones she had worn to her daughter's wedding. Eleanor mentioned the swelling to her primary care doctor, who was appropriately thorough. He ordered blood tests, an echocardiogram to check her heart function, and kidney function tests. Everything came back normal. Her heart was strong for her age. Her kidneys were functioning well. So Eleanor assumed this swelling was just something she had to live with, another indignity of aging that couldn't be explained or fixed. She adapted. She bought shoes with Velcro straps so she could adjust them as her feet swelled throughout the day. She started wearing loose pants to hide her ankles. She stopped wearing dresses entirely because she was embarrassed by how her legs looked. Her wardrobe, once vibrant and professional, became focused on concealment rather than style. When Eleanor finally had a venous ultrasound, we discovered significant reflux in the great saphenous vein of both legs. The swelling wasn't mysterious at all. It was the predictable result of blood pooling in her lower legs day after day, year after year. After treatment, Eleanor's swelling reduced dramatically. She showed me a photo of herself at her granddaughter's wedding, wearing heels for the first time in years. The smile on her face told me everything I needed to know about what that meant to her. But here's the critical point I need you to understand. The swelling Eleanor experienced wasn't just uncomfortable or inconvenient. It was a sign that her venous system was under significant stress. Left untreated, that stress can lead to the 5th symptom I'm about to share with you, and this is the one that frightens me most. The 5th symptom, and perhaps the most serious warning sign of all, is the development of wounds or ulcers on your lower legs that heal very slowly or don't seem to heal at all. Venous ulcers are open sores that typically develop around the ankle area, particularly on the inner side of the leg just above the ankle bone. They occur when chronic venous insufficiency has progressed to the point where the skin and underlying tissue have been damaged by years of poor circulation and accumulated pressure. These ulcers are notoriously difficult to heal. Some patients struggle with them for months or even years. They're painful, they're prone to infection, and they dramatically impact quality of life. What makes venous ulcers particularly challenging is that they won't heal properly until the underlying circulatory problem is addressed. You can apply the best wound care products in the world, see the most skilled wound care nurses, follow every instruction perfectly. But if blood is still pooling in your legs and creating pressure against that damaged tissue, healing becomes an uphill battle. I need to tell you about James Morrison, 79 years old, a retired factory supervisor from Cleveland, Ohio. James was a proud man, the kind of person who didn't like to complain or ask for help. He had worked at the same automotive parts factory for 42 years, starting as a line worker at 18 and eventually becoming the plant supervisor responsible for 300 employees. He had raised 4 children, put them all through college, and was now enjoying retirement with his wife, Helen. James spent his days tinkering in his workshop, helping neighbors with home repairs, and attending his grandchildren's sporting events. He was the kind of grandfather who never missed a game. When James first noticed a small sore on his inner ankle, just above the bone, he didn't think much of it. He cleaned it with hydrogen peroxide the way his mother had taught him decades ago, put a bandage on it, and went about his day. He assumed he must have scraped it on something in his workshop without noticing. When the sore didn't heal after a week, he tried antibiotic ointment from the medicine cabinet. When it was still there after a month, raw and weeping, he started wearing longer socks to cover it. He didn't want to worry Helen, who was managing her own health challenges, including arthritis that had recently required her to start using a cane. James thought he was being considerate by not adding another worry to her plate. By the time James finally showed the wound to a doctor, almost 4 months had passed. The ulcer had grown to the size of a $50 coin. The surrounding skin was inflamed and discolored. James admitted to me that the pain had become constant, a burning, aching sensation that never fully went away. He wasn't sleeping well. He had stopped going to his weekly card games with friends because he was embarrassed about the bandages and the smell that sometimes came from the wound despite his best efforts to keep it clean. James's story had a good ending, but it took time and dedication. It took specialized wound care from a dedicated team, compression therapy that James had to commit to wearing every single day, and treatment of the underlying venous insufficiency that had caused the ulcer in the first place. It took almost 6 months before that ulcer finally closed completely. 6 months of weekly clinic visits, of careful bandaging and monitoring for infection, of lifestyle modifications that James initially resisted but eventually embraced. Helen came to every appointment, taking notes, asking questions, making sure her husband was following all the instructions. James told me later that if he had known earlier, if he had understood what those varicose veins were capable of causing, he would have sought help at the first sign of that tiny sore. He would have spoken up instead of hiding it. Instead, he lost months of his life to a wound that could have been prevented with earlier intervention. He missed his grandson's state championship basketball game because he couldn't sit comfortably in the bleachers. He missed family gatherings because he was too self-conscious about the bandages and the smell. Those are moments he can never get back. If you have varicose veins and you notice any wound on your lower leg that isn't healing normally, please don't wait. Don't assume it will get better on its own. Don't cover it up and hope for the best. This is your body telling you that it needs help right now. Now, I want to take a moment to talk about what all of this means for you personally, because I know that hearing about these symptoms can be frightening. I know that some of you watching right now are looking down at your legs and feeling worried about what you're seeing. And I want you to know that having varicose veins doesn't automatically mean you're going to develop all of these problems. Many people live their entire lives with varicose veins and never experience serious complications. But here's what I've learned in over 20 years of practice. The difference between the patients who do well and the patients who struggle often comes down to awareness and action. The patients who understand what to watch for, who take symptoms seriously, who seek evaluation when something doesn't seem right, those patients have dramatically better outcomes. They catch problems early. They get treatment before things progress. They maintain their mobility, their independence, their quality of life. So what should you do with this information? Let me give you some concrete steps you can take starting today. First, if you have visible varicose veins and you're experiencing any of the symptoms I've described today, whether it's heaviness, cramps, skin changes, swelling, or especially any wound that won't heal, I strongly encourage you to have a conversation with your doctor about getting a venous ultrasound. This is a simple, completely non-invasive test that uses sound waves to create images of the blood flow in your leg veins. There are no needles, no radiation, no discomfort. You simply lie on an examination table while a technician moves a small probe over your leg. The test can show exactly what's happening with the valves in your leg veins. It can identify problems before they become visible on the surface of your skin, catching issues early when they're easiest to address. Second, there are things you can do right now, today, without waiting for any medical appointment to support your venous health. Moving regularly is crucial. Your calf muscles act as a second heart for your legs, squeezing the veins and pushing blood upward with every step you take. Even if you have mobility limitations that prevent vigorous exercise, any movement that engages your calf muscles helps pump blood back up toward your heart. If you sit or stand for long periods, whether you're watching television, working at a desk, or standing at a counter, take breaks every 30 to 60 minutes to walk around or do simple calf raises. Just lifting your heels off the ground 10 or 15 times can make a difference. When you're resting, elevate your legs above the level of your heart when possible. This uses gravity to help drain blood from your legs and reduces the pressure on your veins. Consider compression stockings, which provide external support to help your veins work more efficiently. These come in different strengths and styles, from light support to medical-grade compression, and your doctor can help you determine what's appropriate for your situation. Stay well hydrated because dehydration makes your blood thicker and harder to pump. Maintain a healthy weight if possible because excess weight puts additional pressure on your leg veins. And avoid sitting with your legs crossed for extended periods because this position can compress the veins and restrict blood flow. Third, and perhaps most importantly, pay attention to your body. You know your legs better than anyone else does. You live in your body every single day. If something changes, if symptoms appear or worsen, don't dismiss it. Don't assume it's just aging. Don't tell yourself it's not that bad. Trust your instincts and seek evaluation. You deserve answers, and you deserve care. I've seen too many patients who waited, who dismissed their symptoms, who told themselves it wasn't that bad. And I've seen the relief on their faces when they finally got answers, when they finally got treatment, when they finally got their lives back. I don't want you to be someone who waits until things are serious. I want you to be proactive, informed, and empowered to take care of your health. The truth is, after 70, your body has carried you through an incredible journey. Your circulatory system has pumped blood for over 2.5 billion heartbeats. Your veins have worked against gravity every single day of your life. Some wear and tear is inevitable, and there's no shame in that. But there's also no reason to suffer unnecessarily when help is available. If you found this video helpful, please share it with someone you love. Share it with your spouse, your siblings, your friends from your walking group, or your church community. Because the person who needs this information might not find it on their own. They might not know what to search for. They might not realize that those veins on their legs are anything more than a cosmetic concern. You could be the one who changes that for them. And please, leave your questions and comments below. Tell me what topics you'd like me to cover next. Share your own experiences if you're comfortable doing so. When you engage with this content, it helps the algorithm show it to more people who need it. It helps me understand what matters most to you. And it creates a community where we can support each other on this journey toward better health. Thank you for watching. Thank you for trusting me with your time. And most importantly, thank you for taking your health seriously. Remember, awareness is the first step toward action, and action is what leads to change. Take care of yourself, talk to your doctor, and I'll see you in the next video.